Thank you, ma'am. I think the entire experience has been already briefed here in terms of whatever you achieved in academics or throughout the career as a teacher. I bring wishes from the Department of Clinical Periodontology and Oral Implantology at Royal Dental College, Palakkad. I've been asked to speak to this young crowd on my experience as a postgraduate teacher. It is not a huge, long period of time. It's just a brief period of just 25 years. And when somebody asks you to brief on your experience, then you need to go into a few situations like to know what is a person's experience. When I'm asked to speak on my experience, and if I scientifically analyze what is that my experience is all about, then what I need to understand is experience is basically a collection of memories, what your mind stores inside. And all these collection of memories come from these 5 faculties you have. What you see, what you taste, or what you hear, or what the touch sensation you get out of it, or as we already discussed regarding the taste buds or anything. Anybody's memory becomes his experience. So these are the 5 faculties that help in doing this. And when somebody asks us what is your experience in any subject, I recall what the oldest Nobel laureate had to say about this. When one person was asked, what do you think by getting a Nobel Prize at the age of 97 to Dr. James, who was a chemist, Nobel laureate, was the oldest Nobel laureate, of course. He was awarded the Nobel Prize for the lithium-ion battery. And he said, whatever I've been doing for the last 95 years has been awarded as a Nobel Prize. So that becomes his experience in that field. But for anybody, that for that matter, if you see for their experience as a postgraduate teacher, or as an undergraduate teacher, or as a teacher, or as a clinician, everything doesn't just start all of a sudden from the time he joined for a course. It starts all from the childhood, or maybe from the time of his birth or her birth, as he move on to the kindergarten, school, everything of that sort. Now, how does it add on to your experience? It's like your nursery alphabets. Your nursery alphabets turns to language. The stories you heard, it turns to theories. The mathematics turns to equations or economics or business. And many natural phenomena that you see around turn to be science, biology, physics, chemistry, economics. All these things gets added on to your memory and eventually into your experience. Now, when I joined for BDS, it was like a leap from one kind of a life to another thing that you're going to become somebody called a professional. I joined a professional course, and I was greeted with this kind of figures by your seniors saying that now here is going to be you're going to touch something very serious. This 1 year is going to be very tough for you. If you happen to clear this anatomy, physiology, biochemistry, such basic science subjects, then definitely you're going to have a nice time over. Because this is the most toughest year in the science. That was part of a ragging procedure. And all those cladded Dwarpalagas around. And that's the way we welcomed into BDS, saying that this particular subject, what you're going to deal in the next 1 year is going to be so toughest. So what happened eventually? Studying anatomy was a tougher time, knowing that I did not know studying anatomy was to bring out the surgeon in me. I was learning things in terms of its names, what I see around. The word anatomy itself was to cut open and see. Except for that thing, we are learning every other things. Like in what are the branches of that, what are the cranial nerves. We had a formula or some kind of an equation to learn it by mugging it up. All those things were happening, but this one part I never knew. I was studying anatomy to do surgeries tomorrow. I never knew that. And I never knew this equation also. The physics which I learned, when I added biology to it, it was becoming physiology. I never knew that. I just learned it in terms of the number of birth rate or your pulse rate and all those things, but I never knew it was a physics added to biology that became a physiology. The same thing. When chemistry, what I learned in school and colleges, college I mean the plus 2 level, what I'm referring to, that time when you add those chemistry into the biology nature of it was becoming biochemistry. Nobody told me this one particular thing, that the Krebs cycle is all about the energy that you are living. I was told this is the Krebs cycle equation or formula or whatever it is. If you don't learn this, you will not pass the particular year. That was what it was told to me. Now when I see over the years as a postgraduate and even later as a teacher, this one particular thing is what makes me alive, what keeps me alive. But it was taught in a different manner, saying that unless and until you learn this equation, you're not going to pass biochemistry. So I continued the same way of learning at school. It was all mugging up things. Even I confused it with my professional education. This is the way you should be learning it. You have certain things which your university will write and give you a syllabus. This much thing you have to pass. So it was 100 marks question that's going to be asked in that question paper. You clear just 40 of it, 60 if you don't know, so it's fine. You're going to pass and come out as a doctor. So 60% of knowledge is spared becoming a doctor. That's how it was taught to us. That's the way we all learned. So this was one of the biggest experiments, what I still remember, that has happened in pharmacology department, the making of calamine lotion. You people did it. You all must have done it, right? And making such a calamine lotion in pharmacology department made me feel like an entrepreneur. Like I'm going to make calamine lotion for the rest of my life in pharmacology. But nothing was taught that there is a tablet or a capsule called amoxicillin, which you are going to prescribe to the patient for the rest of your life. And this is what is a capsule made up of. This is how it is being made in a pharmacy or in a factory. And it had, whether you call it amoxicillin, what is the kind of other molecules it's there in it. So the entire life you are going to prescribe one particular drug, and nothing on this was taught to you. Everything that was taught was how to make a calamine lotion, which probably you made it along with 26,000 students doing BDS at the same time throughout the country. And nothing came out as a product. Microbe was introduced to me by Harpic toilet cleaners rather than microbiology department. It was told this is the kind of microbe that's going to eat you, that's going to kill you, that's going to bite you. All those things were told to me and it was very well understood. But the real phenomenon behind it and the real shape of it, when I realize it today, I bet none of you in this crowd, whether it's an endodontist or a conservative person or a periodontist, would have seen any one of this live. Is there anybody in this crowd, by happen to be in this crowd, by any chance, has seen a microbe live? But throughout your life, till your death, a dentist fight against these microbes. You have never seen your enemy. Then how will you figure out the kind of treatment that you are going to render? I tried teaching my postgraduate students to go out and learn how to see a microbe. They were sent to different places throughout Kerala, even outside Kerala. But proudly say there is not even a single institute in Kerala or anywhere nearby that can literally show you how a microbe look alive. No, nowhere you will get an experience of seeing them alive. So it is all your fantasies and the way you think about it becomes the picture of a microbe. It could be having teeth or horns or whatever it is. So in reality, such a picture has not been seen alive by a person who has completed or cleared microbiology during their BDS time or even MDS time. When I cleared general medicine, I had a problem. I never knew what an ECG drawing is all about. I hope you all know about it, right? You all must be very well versed in reading ECG and all those things. At least when somebody some patient show you an ECG picture, you must be acting at least that you can read it well. That may be the thing that many of you people who are doing, who are somebody similar to me. Maybe there are so many people out there who can read it well, I don't know. But when I see an ECG picture, this is what comes to my mind, because this is all I've done with the graph paper. So such a graph paper having to so many lines drawn to that angle, to this angle, it doesn't make any difference for me. When I see an ECG picture, this is what I figure out. In general surgery, the only theory class I remember is somebody had come over, a busy person doing a lot of surgeries in some college or some medical college outside. He'll come and he'll teach about thyroid. Am I right? Am I right? Still continues after 25 years. Something very funny. So they used to teach us on all those other things, and I still remember a general surgeon teacher whom I had. He used to come like this only to the class, because he had every intention of talking about thyroid only. Thyroid, and he usually forgets. The previous class also was on thyroid. He used to just give lectures on thyroid and many other organs in the body, and eventually what I landed up is, I understood there is some kind of a coercion being given to these general surgeons to speak on this thyroid. Other than that, I didn't find any reason, but this was for sure. Management of faith for me was clearly taught by surgeons to us. Raise the skull, keep you probably, if it's possible, place the patient upside down, hold it on the feet and hold it like this, and the entire blood that is stored in the feet will flow to the brain. So raise the skull slightly, then if at all it isn't taken up, okay, pull it up upside down. So the idea was, it is something like an hourglass which has got the entire blood in the feet, and that has to flow to the brain probably. So you lift him as much as possible. So this phenomenon will work, physics, and the person will be revived. This is the impression what I had. Are you people also have the same impression? Do you know anything other than waking up a patient who is fainted down? I don't call it syncope or anything, vasovagal and all those technical terms, because none of us know anything about it. So let's make it simple. Somebody fainted down. The only probable thing you might do is to sprinkle water on his face, because that's what is being taught by movies. First thing what we do. Then we tap his face and call his name and all, because that is all something which has been told to us by movies or school teachers or somebody somewhere else in those manners. But the real technical side of all those syncope hardly came from any classrooms. So I still wonder why such a video was never shown in our classrooms, probably because such video never existed during our times. But this is very much available in the internet nowadays. But then why not you show, or a teacher show such a video in a classroom which clearly make you understand how a WBC works. This is how a microbe kill that thing. It could be clearly figured out. But such a video doesn't come in any classrooms. This is more than enough to teach a host response to any student of any caliber. This is how it works. It finishes off the chapter by itself. But if you start doing a kind of imaginatory class saying that there is something called a WBC somewhere in that place that will be formed by hemopoietic cells and that will come and kill this microbe, then that becomes the wide, vague imagination of a student which will never have anything in reality or which has got anything to do with the true nature of it. See, many of these procedures, I can illustrate you in this way. I had a different opinion or a different idea on saliva, blood and tongue. For me, the biggest enemy for any dental procedure is saliva, blood or even tongue. You could be better doing or best doing any dental procedure if the patient was having xerostomia, was dead or not having tongue. This is the way the thing was put up. I'm talking about my experience. I surely know none of you have got this bad experience. You must be having a very good experience all this. But I'm talking about my side. This is the impression what I got about it. Blood is your enemy. Saliva is your enemy. Tongue, my God, that won't allow you to do anything in oral cavity. But such a thing was never told to us. I heard something new today. Occult theories. Very, very, very new to me. So this was a mechanism which said saliva was the blood supply to the enamel. Enamel was avascular, agreed. There was no vessel in the enamel. There was no vessel in the dentin. Then how will it live if it doesn't have a blood supply? Everything should live on a blood supply. So my God, later on somewhere during my process of postgraduate life, I understood saliva is actually the blood supply for enamel. And dentin also has got its own blood supply. That blood supply was derived from the pulpal vessels. Oh, that is the condition. Then why shouldn't an enamel have a blood supply? Or why shouldn't an enamel have a vascular supply? Yes, if enamel has a vascular supply, then there will be a term called enamelitis. There will be a term called dentinitis. If at all such a term exists and if such a phenomenon exists, then forget about biting on anything. Your enamel also will start swollen up. Oh, that is the idea. What nature had hidden in it. Yeah, I understood. So 5 to 6 years of BBS life was fantastic now that you all are here for an MBS. It made us all two very dedicated professionals. Learning conservative dentistry, dental students never ate chocolates, sweets or anything. Something that was supplied as your... The quiz has been made fantastic by honoring the winners with chocolates. So when the entire conservative dentistry taught you eat chocolate, you will lose your teeth. So this was the condition. So being a professional in dentistry, we are totally against it. But this is how you greet your HOD on your conservative HOD on his birthday. The same thing you do when you pass and come out. You are going to get laddus to your conservative HOD, pan parat to the oral medicine HOD, and then some kind of staining thing to the peri HOD. That's how you are going to greet them. Now what does all these mean? So you are not convinced. Same thing, public health dentistry throughout the 1 or 2 years of its learning, it was taught health for all by 2035. 2035, there will be 100% dental health that you don't need dental clinic anymore, you don't need dentist anymore, we are working so hard against it. We had a dream of my clinic being shut down also. That's why we learned public dentistry. Now today when we are ill, then how will you live? What is the point in learning a subject that will make patientless? You should be learning a subject that will give you more earnings, right? Not an abandoned clinic like this. I don't want my clinic to be like this by the age 2035. Do you want to be yours? I don't think so. Now, learning periodontist. All of you get your teeth scaled every 6 months, don't you? When did you do your last one? So, educating, motivating patients, all of you do flossing every day, I know about it. If not in the morning, by any chance you missed it out, you'll be doing it definitely in the night. Oral medicine, I don't see any dentist smoking, never. Except for that peri HOD who is sitting behind over there. I have not seen anybody in... are you looking at Josh Paul? No, I didn't read it. Okay. So it's like very hardly I have seen the dentist in my period of time who doesn't smoke. So oral medicine did wonders to them, knowing that leukoplakia and such lesions are all products of tobacco. Our PG was still more fantastic. I'm talking about perio PG. It was very, very fantastic. It made us more refined, more professionals. This is the way people used to brush before joining for perio. And after that, this is after MDS. I take around, actually that is the one reason why I was late for this class today. I was brushing for around 20 minutes in the morning, and then I do the same thing at night also. Night I used to brush around 40 minutes because unless and until I complete all those kind of chartered bath method, I'm not fresh at all. So I keep doing this, looking at the mirror, and I'm so meticulous in doing it also. As an MBA student, I used to recommend patients, you have to get your teeth scaled every 6 months. You also must be doing the same, right? You were recommending your patients to get your teeth scaled every 6 months. Now, when I joined for MDS and probably towards the end of my MDS time, I was asking myself, why the hell should somebody get their teeth scaled every 6 months' time? This is not a quiz. Don't confuse it with the quiz. It is totally my experience. Only my experience. So I've never understood the reason why every patient should undergo such a scaling procedure every 6 months. As an MBA student, I used to recommend FPD to higher extent implant also. But FPD was my favorite. Anywhere if you find a ridiculous area, I'll ask them, go get your FPD done. Go get both the teeth next to the ridiculous area, root canal treated, and then you will get a crown over it. The name crown was very fascinating for me that time. Then you will get a nice FPD, your ridiculous area will be fantastic for chewing and all those things. Now, after seeing all the conditions what that person has undergone after placing an FPD, I'm talking about my experience, okay, not yours. It's all because of my bad hand that every patient who come back to you with food impaction and such complaints, slowly my attitudes towards that also changed. Now, I used to recommend orthodontic treatment for anybody who needs some minor corrections, some proclination, because after being a dentist, you definitely have got a habit of looking to the mouth and teeth of every person. So you will find every person as an opportunity for treatment. So definitely that makes you a higher end dentist, and you will recommend you go get your teeth wired up immediately before your marriage. So all those things used to come for the beautification, and probably today when I look back to those patients, I truly disown that prescription. Like, I can understand what has happened to that small change that was supposed to happen to that patient with some minor corrections that has landed up in situations. So I still remember, or many of you, if at all you have gone through this, soon you, at least periodontist, oral surgeons and prosthodontists will definitely remember the day when the guy walks in and say, okay, now it is your turn, now you're going to place an implant. All these 1 or 2 years time, I'm talking about the people who are here right now, the next 1 or 2 years, you will face this situation. When your guy comes and tells you, go place an implant today, and probably if you do it, then definitely this will be a condition. If you meet that same patient on road after 1 or 2 years, the first implant case which you have done and the person is coming just opposite to you and you've got a seminar, you will take the shortest route to the seminar room possible to avoid such a patient. There is no other option for it, right? But what I did was what I learned. Did I? Yes. That's where I landed up. I'm not talking about you. It's my experience, right? I want to speak on my experience in dentistry. Right? So I read, I learned and practiced it all the way everyone else did it. I also learned the same thing what you people learn. But you all are excellent practitioners. I became somebody like this who has to hide away from the patients. Yeah, I was licensed to do it. I had the BDS degree which you people also have. But I was not taught. I was not taught well. I was reading, I was learning, I was seeing, I was experiencing what others do. But I wasn't taught well. Probably that is where the cling comes. For me, knowledge on basic things appeared senseless at times. We just had a trial of it. Many things which we are supposed to know being a BDS person, that masseter is the strongest muscle in the body. None of us knew. So many things what we think is senseless becomes science. Many things what we think is science becomes senseless. See, I know 10 different ways of brushing. I can teach you that. I can be a pacharam for that. So I know 10 different ways of brushing. I know meticulous methods to manage deposits. I know that I can prescribe you to have the last speck of calculus being cleaned from your mouth. But I'm yet to understand why this fellow doesn't brush. Every time you brush for 20 minutes or 40 minutes, this fellow looks at your face and laughs. That fellow doesn't brush. Then what is wrong with this animal? Why these human beings are the only animals who have to undergo this kind of a torturing for 2 times a day or 3 times a day? These fellows doesn't need brushing at all, and they don't have calculus also. What could be the reason? Why these teeth have got something called primary trial? We don't have a trial of eyes. We don't have a trial of organs anywhere in the body, but has been kind enough to give you 20 teeth in the beginning. You work on it, work well on it, and finally if you happen to lose it, or you will not lose it, or you lose it, some at a certain age it doesn't stay there, the new one comes popping up from down. But even at a younger age, if you lose the second one, you don't have a third one. Why is it so? It's not a question. It's just a question to you. Why? Because first set of teeth has been given to human beings. If you lose it, the second set is given to you. If you lose that, then gone, finished. There is no third set also. Why are these things happening? Or why should be the reason for it? Why does this one particular thing? You join for BDS. Your auntie, your uncle, your father, your mother, everybody will start asking, have you started to pluck your teeth? Have you started, not your teeth, have you started plucking teeth? Have you started extracting teeth? Everybody wants to know whether you started that particular thing. Which is that particular thing? Killing your patients. Have you started plucking, extracting? This is all they want to know. The entire society asks you, have you started plucking teeth? Now, do we do the same thing to MBBS people? Somebody has joined as an eye specialist. A patient will come and ask you, have you started to pluck eyes? For a cardiac surgeon, will they come and ask you, have you started to pluck heart? Have you started to pluck liver? Have you started to pluck pancreas? Have you started to pluck nose? Have you started to peel skin? Nothing but one particular thing is about dentistry is, we are talking about preserving the tooth, we are talking about a science based on teeth, but everybody wants to know whether you are capable enough to pluck that fellow's tooth or not. You are not joined any gym or anything, right? You joined a dental college that's teaching you dental science. Yes. My dental education left out with a lot of questions and doubts for me. I understood education is not to satisfy the parents who sponsored my studies, not the teachers who draw salary every month end, not for them for sure, no. It's not for the examiners who are paid lump sum for conducting exams and taking viva for you. Do you know that? Do you know the examiners are not paid well? Do you know that? Yeah. Now, it's not meant for the college which will celebrate your first rank and second rank and number of participations in that, this thing and all those university toppers and the percentage of pass. It's not meant for them. My education is not meant for them. Not even for the university who grants me the degree. My education is not meant for them. Am I right? Do you agree with this? Do you get your education done for anything or anybody out there? To any of them? No. Education is much more than learning, memorizing, and mimicking what you saw. It is much more than that. Purpose of education is not to earn a job or a salary. The education has got nothing to earn you a job or a salary. Education is something else. Education is rightly defined. It's defined as something else. It is the manifestation of the perfection which is already there inside you. Your body functions very well without being a doctor. Every engineer's body functions very well without knowing anything in medical science. It's you people who are learning your body. It's not that a dentist won't have dental caries. Even after having so much of knowledge about dental caries, a dentist also can get dental caries happening in his teeth at all. So it is like, it has got nothing to do with education. It is the manifestation of the perfection which is already what you are. My dental education is complete when I understand myself to be undoubtful and questionless. I should have a clarity on my professional degree. I should have a clarity on what I am practicing. For that, you need to have a companionship of a person who constantly keeps you doubtful. You need to have a companionship of a person who constantly keep you doubtful. You are always filled with doubts. and you are so inquisitive, and finally, that person who kept you doubtful, that person who kept you inquisitive should give you the final Narada. Narada means knowledge, Da means the one who gives it. So you should have a companionship of a person with you who is not going to leave you in the comfort zone, but he will keep pestering you. Who will keep pestering you. He'll make you fully doubted. He'll make you restless. He will never leave you in the comfort zone. But finally, end of the day, that same person will give you this. That's how that person is depicted as. Having said this, my topic for today is an experience of a PG teacher. You had a good experience, or you listened to the kind of experience that I have gone throughout these years. Now, to understand my experience in it, you should be knowing how I see teaching as. I see teaching as this. There are 4 quarters of education. Let it be MDS, let it be BBS, let it be any professional course, or let it be any course. There are 4 quarters in which you learn it. The first quarter belongs to an acharya or a teacher. Just a quarter of it. The second quarter, it belongs to you yourself and your resources around you. Your laptop, your computer, they are all media to get yourself connected to that knowledge. The second quarter deals with that. The third quarter has to come from your colleagues. Has to come from your colleagues. You need to have a discussion with your kind of people around. Not the teachers, not the resources, but humans. Human beings alone. The one who is closer to your vicinity, whatever it is. You need to discuss with them and understand it. And the last quarter has to come with your experience as you move on. It has to come with your experience. So your teacher has got only a quarter of role to play in your entire education. Now, a student learning by himself, just look at this picture. That deposit is not because that person didn't brush today morning. That deposit is a product of a person not using that tooth for a long time, right? Because it had a caries over there. See, this particular tooth has got dental calculus on it because that tooth is being deprived of chewing. So this is something that a student learned by himself by looking at it in a very conscious way. Now see, this person has never brushed their teeth for 16 long years. But the left side of that teeth, the left jaw, he has got teeth which are absolutely clean. No calculus over there. That person has not brushed their teeth for 16 long years. But one side has got calculus. The simple reason is that person is chewing with the left side. Simple as that. Now how do you relate it? Related it to the nature what I saw. It's the same story. During COVID time, that area in between, that is staying vacant, had a lot of grass in it. Now once you start walking through that place, there will be grass around that area except for the place where you walk. So that simply showed the reason why there was no calculus on a teeth which has been properly, meticulously used for chewing. And the area which doesn't undergo chewing will definitely have calculus and deposits on it. So what happened here? Today, nowadays, what happens here? Acharya gone, teachers, the help from the teachers gone. There are no colleagues around you. You don't like to discuss your cases and your discussions. You don't want to involve your colleagues into it. Experience, where you're talking about experience when your academic itself is not done properly. So all these things are gone. All you have by yourself is knowing things by yourself. And you've got numerous media around here to make you people more and better dentists. And even today you've got ChatGPT and other things which probably the last 1.5 hours of class taken by Harikumar sir is a total waste. If you can apply this one next to your dissertation period, if you have somebody like a ChatGPT next to you, it's all easy to write. You just give orders to that fellow to do your work. That's what the entire ChatGPT is going to do to you. But the essence of medical science can only be taught, not learned. This is where the entire system changes. A misinterpreted media knowledge without discussion with colleagues and then having nothing of your own experience probably misguides you. You have to be very careful about it. Without a guide in your profession, you could be a qualified quack as well. You could be doing orthodontic treatment for such cases. You could be having failures in the procedure, FPD procedures. You might be filling a tooth or trying to call it restoration or you call it filling. Filling of tooth with the entire restorative material going into the sulcus or to the contact area below it. Or you might be doing fantastic endodontics like this. You might be doing superb, well-integrated implants like this. You might be doing extractions, sparing, or removing good amount of bone along with it. You could be doing such kind of restorations. You must be doing such fantastic treatment for food impaction. All those things you must be doing it because you learn to do it. You know how to do amalgam, then why not do it? Your basic common sense says this will prevent food impaction, so do it. Why not? Yeah, that should be the way you should be trying all these things as well. You must be a very successful implantologist and been doing this kind of thing because you are successful in terms of the way you talk. So probably you might turn out to be a qualified quack also. Even a well-learned dentist may find his right in doing this. This is the funniest part. But never a guide-trained dentist. This is the thing in a postgraduate life. Because learning is not training. Training is repeatedly learning the same thing. You did one root canal treatment, do another one. You did one pulpectomy, do another pulpectomy. You did one ortho case, do another case. You did one scaling, do another one. You did an implant, do another one. Keep on doing it. This kind of a doing makes it training. And that is what is clinical experience that is to be gained. You have seen somebody doing such a case, you have seen your seniors doing such a case, doesn't give you anything at all. You doing it and keep doing it, that makes it called training. Are you a trained right person? That's the question. By the end of your MDS 3 years, you should be asking this question to yourself. Are you trained well? Not learned. Learned means I also had learned enough doing all those procedures. So now, who is that teacher who is going to guide you? This teacher also has got a very beautiful definition. A teacher should be having enough of knowledge in a subject. A master knowledge in the subject. Not just that. He should be able to impart that knowledge to a student at that student's capacity. That student may not be as intelligent as we can't help it. But you should be able to explain that science to him because it is being said. If you cannot explain something to somebody in a way that person can understand, that simply shows you have not understood it. That's the way a teacher should be explaining to a student. Now, these two doesn't make a complete teacher. The third most important thing, to identify a teacher or a guide, that's the third one. Is that person practicing what he teaches? That is the most important thing. He should have knowledge enough. He should have the skill enough to impart it to the student, and he should be practicing it by himself. That makes a guide. That makes a teacher, that makes a mentor. Less than that, a person who is having any of these qualities less cannot be called as a teacher. He is a good professional teacher who draws salary very well. Now, a teacher is someone who teaches you things he loves to teach. There may be some favorite topics of teachers. You heard about it. You must have heard about it from your colleges also. That teacher is very good at that particular subject. He'll come and teach what he likes. He has an answer to all your questions. You ask any question you actually, he'll be knowing the entire thing under the sky. He's a beautiful, lovely teacher. Yeah. Now, one short is guide. Guide is someone who teaches you what you love to be taught. He's a guide. He will make you answer your questions. He won't answer any questions. He will make you answer your questions. He is a guide. One step ahead. Your mentor, who is someone who makes you observe what he is doing. That's all. He won't teach you anything. He won't give you an answer. He will make you observe what you wanted to ask. He will do it for you and show you. And what is he? He is the answer to your questions. He is the answer. So you have got different levels of teaching as well. You might have landed up in the hands of a teacher. You might have landed up in the hands of a guide, or you might be having a mentor. One step ahead is an administrative post, which my classmates over here, like Dr. Jiju, Dr. Anil, they are all much above, little bit above the mentorship. They mentor mentors. So these three things you need to understand to identify a guide for you. Unless and until you have a guide to lead you, hopeless. Role of a guide in postgraduate life is very simple. All they need to do is this. Whatever is not meant for you has to be carved off. The rest is all clearly there. This is what it is all about. The sculpture is already in the stone. What you need to do is, you have to remove the unwanted material. Make the vision clear for the student. Objective of MDS education, what I understand today, because this particular topic is on my experience as a postgraduate teacher, I teach my students for one simple objective. If I happen to get some treatment done from my student, then that person should be good enough to do it. If I don't teach my students the way I want to get treated, and if tomorrow I need a treatment, whom will I approach? That's the way a teacher should be teaching their students. But often this is what is happening in most of the departments. It lands up this kind of a training, and finally a beautifully scarred culture might become disfigured like this by the time you come out of postgraduate times. How does an MBA teacher guide? How does an MBA teacher guide you? He guides you in these three topics, under these three topics. One is academics, the other one is research, and the third one is the clinical way. How does this happen? Academics means what? Anything and everything that you see around. Read, hear, watch, observe, discuss, present in presentation as seminar. Even something you learn about research is part of academics. Learning, the previous class what you had here was part of academics, not part of research as such. It was learning research, so it becomes somebody else's experience. Whatever you gather from outside, they are all under the topic of academics. That is what you learn from others. You could learn it from the library, you could learn it from your resources, you could learn it from classrooms and discussions, you could have other methods during your conferences like this, and CD programs, training programs, all those things comes under your academic part of dentistry or your postgraduate life. What is research? Anything you heard, saw, read, observed or discussed, you want to experience it of your own. Like somebody wants to know what is the time now. What do? You look at your wristwatch, right? This has got a research attitude in it. So otherwise you can just guess, it must be 10:30 in the morning, 12:30 in the afternoon. There is no research involved. Research means you wanted to do it by yourself and you did it, that becomes research. It is something like revision. That's saying something very similar. You want to do it of your own and find out whether what you heard is right or wrong. Now, research arises from a genuine research question. Nothing less than that. A research starts with a question and ends up with an answer. Everything that you do in between is the part of research. Unless you have a question, your research never happens. See this fellow on top. He had left a petri dish in his laboratory and went for a vacation with his family, came back after 20 days. He saw something else being grown in the petri dish. What was the answer? Penicillin was the answer. The person is, yeah. So he had a question to himself. You people would have left your dining dishes year days together in the sink in the kitchen. You come back and see all those things dirtified, you clean it up and go, right? You never asked any question to yourself. This fellow asked a question to himself and the answer was penicillin. That fellow had some rays passing through his bone, long bone. He saw something there and he asked a question. Answer was X-ray. The third person had a problem. He had kept some titanium cylinder in the long bone of a rabbit and he tried to remove it. And what was the answer? Dental implants. I'm still trying to figure out why the hell did he place such a titanium chamber in the long bone of a rabbit. So I am into such a question, but the answer is not implant. Answer is still being envious about that person who went and did the biggest marketing in his life. So that question resulted in an answer, and that is all about research. A research guidance is creating a research question in a student and teaching him the way to find an answer. A student comes and asks a teacher, ask an oral medicine professor, so what is that white lesion seeing over there? That is oral implant. There ends the question of this student being a researcher in the future. There ends. So it is something else. How does a research guidance happen? The research guidance happened in this manner. This fellow was walking on the ground, sitting under the apple tree, but suddenly one thing happened, something fell on his head, right? That was the time he jumped up and said, gravity, gravity. Did you do that? No, something fell on his head. Then what happened? He developed a question. Why is it falling down? Now, did the word gravity simply pop up in his mind? No. What he would have done, the same thing what a student did when he went and asked an oral medicine professor, what is that white lesion over there? He would have gone and asked some of his teachers, or he would have gone and asked somebody, why are apples falling down? He would have given the exact hypothesis existing at that point of time. He would have said something which was very convincing for the entire world till that time. What was that? Something. I don't know what it was. But Newton would have definitely got an answer from a teacher. The teacher would have told, yeah, everything falls down because of God's grace. Praise the Lord. Finished. That ends up the research question. But somehow, this fellow was not convinced. What he would have done? He went and wrote in a piece of paper, my research question is, why are apples falling down? Research question. He would have given a brief background of what made me think in those terms. Why did it fall on my nose or my eyes and I had to be hospitalized? No. Why is it falling down? Why is it not instead going up? That entire thing, he wrote it as a background of it. Then he developed a need out of that particular research. He asked himself, if at all I find a reason for this thing falling down, what all could I answer? Yes, a need for that thing. Immediately he would have gone and searched for the hypothesis existing into the review of literature. He would have read a lot of literature pertaining to that gravity. Not gravity, at that time, whatever it is. He was not convinced with it. So he demanded, or there was a demand for a study, an original study, that is rationale. Rationale for that study. With a rationale, he immediately developed an aim of his study. Aim is expanded into objective. Aim is this hall. Objective are those two staircases landing. Land up to the first, then to the second, you reach the hall. They are the objectives. There might be things what he had done after that. A lot of experiments. That becomes the methodology. And end of the methodology, he will get observations. So he'll get to know some figures. He'll do a statistical analysis of this and he'll get a result out of it. And finally, he'll conclude it what the finding was. And then comes the answer to the research question. So a research starts with a research question and ends up with the answer to the research question. So a good guide makes you not to beware of the things that will fall on you, but be aware of anything that falls on you. Yeah, we have got around 7,000 PG dissertations happening in the colleges throughout the country, and most of them lands up in RIP. Now, a few of them comes up as publications. That is something very important. So dissertation, by doing a dissertation, what you have done or what you have achieved is you just got to know how does knowledge comes to you as a package or in a textbook. This is how things comes to you. That's all. Now, when you publish your dissertation, that means you have done your dissertation, you have learned how to do a research. If you have got something that you have to add on to the pool of knowledge from where you started your dissertation, then you got to publish it. Then you have to publish it. Publication makes you a reference for somebody else. You become a reference. Clinical guidance and training, let me short it up. So all this academic knowledge and the clinical evidence-based, research-based things has to be properly blended and a management solution has to be derived. This is what is clinical training is all about. At least a clinical guidance make you feel you are being treated by you. That's the only thing what a clinical guidance is all about. Guidance to make you feel the patient's pain. Now when you mix this academics, research and clinical thing, there is nothing called periodontics, orthodontics, oral pathology, oral medicine, nothing like that. You are just becoming another example of one person climbing that elephant. Don't be so stringent in this outlook. You need to complement each of these specialities and understand dentistry as a whole. Did I disturb your comfort zone in any manner? Now, don't become just another postgraduate student. Explore your passion. That's most important. Explore your dream. Take a path least traveled. You take a path least traveled. Do something which nobody else has done. You succeed in it, what will you become? You'll become a leader. Yeah, you are the first person who has done it. If you fail in it, what will you become? You took the path least traveled. You lost it on the way. What will you become? What will you become? A guide. Yes. If you succeed, you become a leader. You will find a guide waiting for you otherwise. If you fail, you will find a lot of people who have taken that path and there will be somebody in that path who will be waiting to guide you. Beacon. It doesn't come searching for you. You come in search of it. Am I right? Because you know beyond it, there is a vast sea, vast possibilities beyond it. That's the reason why you have come in search of Beacon. Thank you, ANNOOR Dental College. Thank you so much. We are so much being here for NCPP for so many times. Thank you, Prof. and his team. They overextended a little bit. Thank you, ANNOOR.